Vanakkam. Hands can get injured anywhere, at home, in the workplace, on the road, anywhere and at any time. What do we do in such situations? How do we handle it? How do we give first aid before taking the patient to the nearest hospital? And when the person reaches the hospital, there may or may not be experts in hand surgery at that particular point of time. But there are going to be medical professionals, doctors and paramedics. What help can they do? After all, first aid can save lives. And as far as the hand is concerned, first aid in hand injuries forms the first step to restoring function in the hand. And that is whether it is a small injury on the tip of the finger, or a major crush injury, or a hand burns, or even amputation of the fingers or hand. How is that? We shall see in this video. When we learn about first aid in hand injuries, we shall learn about what is first aid and why it is important, first aid in the home, first aid for hand burns, how to stop bleeding from a hand wound, how to bandage a finger wound, what is the first aid to be done in a major injury on the hand, how to apply a dressing for the entire hand, why and how to apply a splint, and what to do when there are total amputations of the fingers or hand. What is first aid? First aid is the medical help that is given to somebody who is hurt or ill before the doctor arrives, and this is according to the dictionary. And where is this first aid given? It could be given in the factory, home or road where the accident has occurred, or in the primary medical center where the patient has first approached. Here, the expertise to treat the hand injury may not be available, but the medical personnel there can give a more sophisticated first aid. First aid is always important in any injury or illness, and it is doubly so in hand injuries. Any treatment for a hand injury must result in a good functioning hand, and this depends on wound healing. And wound healing depends on the status of the wound. That is, there must be no dead tissues or infection or foreign bodies, there should be no edema, and we should try to preserve the vascularity of all the important tissues, and all these can be attained to a certain extent with correct first aid measures. So as far as first aid in hand injuries is concerned, it helps to save life in major injuries, and it helps to save the limb as it plays a vital role in getting back function. In case of minor hand injuries that can occur, the first aid can be done as follows. For demonstration purposes, if this is considered to be a minor hand injury, first it needs to be washed well in running water. Then a gentle compression with a clean cloth should be done. There is no need to apply undue pressure at this point. A gentle pressure is what is required. This must be continuously applied for about 2 minutes, after which the cloth can be removed. It is ideal to get medical help if the bleeding does not stop or the wound is large. In the primary level medical center, assessment of the wound can be done and a dressing can be applied as shown if there are no demonstrable injuries to the underlying structures. Let us assume that the red line that has been marked on the finger of the volunteer is a wound which has to be dressed. First, after cleaning the wound well, a paraffin gauze dressing is to be applied. This can be prepared, or a commercially available paraffin gauze dressing known as tule grass can be used. Over this, a gauze piece is applied, first on the volar aspect, then wound over the tip of the finger to the dorsal aspect, then wound back to the volar aspect, and then taken circumferentially around the finger. Holding this gauze piece, a finger elastocrepe bandage is applied, starting from the volar side over the tip and then going around the finger. This compression should not be too tight. The end must be secured with a short 1-inch micropore plaster that should not be circumferential. The next common injury that can occur on the hand is burns. We need to know how to manage burns of the hand at the home or the place where the burns has occurred. The first thing we need to assess is the depth of the burn, and this can be assessed if we understand the anatomy of the skin. The skin has got two layers, the epidermis and the dermis. The epidermis is a very thin layer, and underneath that we have the superficial part of the dermis, which is known as the papillary dermis. The deeper part of the dermis is known as the reticular dermis. Only this epidermis and dermis constitute the skin. Under the dermis we have the layer known as the subcutaneous fat. When burns involves only the epidermis, it is manifested as redness on the skin, and this is classified as first degree burns. When the burns involves up to the papillary dermis, it is known as superficial second degree burns, and when the burns involves up to the reticular dermis, it is known as deep second degree burns. Both superficial and deep second degree burns will manifest with blister formation. So if blisters are seen in the area that has been affected by the burns, it is a second degree burn. These blisters should not be removed. If they are very large, using a sterile needle, they can be punctured so that dressings can be applied easily. When the burns involves the entire layers of the skin, that is the epidermis and dermis, it is known as third degree burn. This manifests as charred or whitish tissue. When considering what is to be done when a burns on the hand is encountered, there are a few things that should not be done. For instance, do not pour ink on the wound as it may mask the clinical findings, and hence the assessment of the burn wound may be difficult. Do not apply any substance like turmeric or any coloring agents for the same reason, and do not place ice over the wound. Instead, there are certain important do's that should be done as first aid for a burns on the hand. Do wash well with cool running water. Do cover the entire burn area with a clean moist cloth, either a handkerchief or a towel depending on the size of the burn wound, and do elevate the hand and send to the hospital immediately. If this represents a burn wound on the palm, a wash is given with cool running water and a clean cloth is applied over the burn wound before being transported to the nearest medical center. Sometimes we come across a wound on the hand with excessive bleeding. The wound may actually be small, but the bleeding may be excessive. In these situations, what we tend to do is apply many pads over the wound and apply a dressing. This will not work, and this is the result. The bleeding will continue under this bulky dressing. When there is a wound on the hand that is continuing to bleed heavily, you may want to elevate the hand, but this may not work sometimes when the bleeding is under pressure. You may want to plunge your artery forceps and get hemostasis, but you may damage the nearby nerves or tendons. You may want to put multiple Gamgee pads and apply a bulky dressing. This will just not work. You may want to apply a tourniquet and raise the blood pressure to 100 millimeters above the systolic BP, but it is temporary and can only hold on for 5 minutes as it will be painful. What you should do is apply a compression dressing. Apply a small absorbent gauze over the wound just the size of the wound. Apply another similar size gauze and another over it. Now apply a folded Gamgee pad and then a full Gamgee pad. Now apply the bandage. This way, the compression provided by the bandage will be concentrated on the first piece of gauze that you applied where the bleeding is occurring. This sort of a major hand injury that usually occurs in a factory or on the road in a road traffic accident may be very dramatic, but it is important to remember, as the pioneer of hand surgery Professor R. Venkataswamy used to say, remember, there is a person attached to the hand. So the general condition of the patient who has been injured must be taken into account first and must be evaluated according to the ATLS. We should rule out life-threatening injuries like head injuries, intra-abdominal blunt injuries, or chest injuries, and then look for other limb-threatening injuries which may be more proximal to the wound that is seen on the hand. The sequence of first aid for such major hand injuries in the factory or roadside is first wash with ordinary running water, a dressing with a clean cloth, and a splinting if possible. When the patient reaches a primary medical center, a dressing can be applied on the hand as follows.
Before we go into see how this major dressing is done on the hand, we shall emphasize on three important points to be remembered before doing the dressing. Point number 1. Keep the thumb separate from the dressing applied on the fingers. That is, the thumb must not be in the same plane of the fingers after the dressing. Second important point, we must place gauze pieces between the fingers in the finger webs before applying the pad over the fingers. And the third important point, after the dressing on the hand, the fingertips must be kept exposed. I shall demonstrate a complete dressing on the hand on this volunteer. The line that is marked on the palm represents the wound. First, after cleaning the wound, a paraffin gauze is applied here. This will ensure that there will be no pain when the dressing is being removed. Either such a paraffin gauze can be applied or a commercially available paraffin dressing which is known as tully grass can be applied. The paraffin gauze can be prepared by soaking pieces of gauze in liquid paraffin and autoclaving them. The next to be applied is a gauze piece. Here a gauze piece is applied because it is a small wound. Depending on the size, either a gauze piece or a pad needs to be applied. This is the absorbent part of the dressing which is going to absorb any soakage from this wound or exudate from this wound. In cases where you expect bleeding from the wound, instead of placing a single gauze piece, place multiple gauze pieces one over the other before applying a pad. This will ensure that the compression of the pad will be concentrated on the area of the wound and ensure hemostasis. Next, gauze pieces are placed between the fingers to ensure that there is no maceration of the skin in the finger webs. Now the pad is placed and made sure that the thumb is placed in a plane perpendicular to that of the fingers. This can be ensured by running the pad through the thumb web, and this will ensure that the thumb remains separate. Then the bandage is used to wrap up this dressing. This bandaging is the secondary dressing that is being applied to secure the primary dressing. After finishing the application of the bandage, avoid tying a knot. Instead, secure with a small piece of plaster and ensure that this plaster is just about an inch in length and does not go around the circumference of the hand. If the dressing is going to go and involve the fingers also, in case of injuries involving the fingers, the pad needs to go around the fingers too, and here it must be ensured that the tips of the fingers are kept exposed.
That brings us to the concept of splinting the injured hand. The first question is, why should we splint the hand? The second is, if at all we need to splint the hand, in what position should the splinting be done, and how is it to be done?
Let us see what are the advantages in applying a POP and why we need to apply a POP. The most important effect of applying a POP is that it prevents movements, and when movements are prevented, the healing of the structures is better, edema control is obtained, and there is good pain relief as there are no movements at all, and all these factors are very important for the well-being of the patient and complete recovery. So which are the situations where you need to apply a POP on the hand? The first is diagnosed fractures. When you have diagnosed some fracture, the POP should be applied either as a temporary procedure before the definitive treatment is undertaken, or the POP itself can be the treatment for the fracture. Second is when there is a tendon injury, like in this example where you can see the flexor tendons have been cut for all the 3 fingers and the fingers are kept in a position of extension. So the POP must be applied in these sort of patients, just as we had discussed, either as a temporary procedure till the definitive tendon repair is done or after repair of the tendons. The third situation is when there is a major injury on the hand or there is a skin loss. Mainly the POP application here is for pain relief. If the finger injury involves more than 3 fingers, it is ideal to apply a POP to reduce the edema and to reduce the pain. When there are burns on the hand, application of a POP is very important because it controls the edema. And when there is a blunt injury of the hand, even if there is no fracture as seen in this example, the POP application will help control the edema. And lastly, when there is an injury to the finger or thumb or hand and there is a vascular problem, as in this example where you can see that the thumb has been partially amputated and it looks very pale. So a POP needs to be applied before the definitive treatment is undertaken to prevent the shearing of the blood vessel which has been injured inside.
Having understood why we need to splint the injured hand, we shall now see in what position the hand should be splinted.
We shall now see what are the different positions in the hand. First, we shall see the position of ease. When there is an injury to the hand is usually held in this position due to the effect of gravity. The wrist is in a flexed position and consequently, because of the stretching of the extensors and the development of edema on the hand, the metacarpophalangeal joints become extended or sometimes even hyperextended, and as a result, the interphalangeal joints of the fingers become flexed. The thumb also stays in an adducted position. This position is very detrimental to the function of the hand and should always be avoided by applying a POP. The next position to consider is the functional position, or sometimes known as the glass holding position. The position of the wrist is in minimal extension of about 10 degrees. The metacarpophalangeal joints are kept flexed at around 60 degrees and the interphalangeal joints are kept flexed. The thumb is kept in a position of palmar abduction. This position is a very safe position in which to apply a POP in a case of a major injury to the hand. The other important position of the hand in which it can be placed within the POP safely is the lumbrical position or intrinsic plus position. The difference between this and the functional position is that in the lumbrical position, the metacarpophalangeal joints are kept at 90 degrees and the interphalangeal joints are kept extended. The thumb is kept in a position of palmar abduction and the wrist is kept extended at about 30 degrees. It is important to note here that keeping the wrist in either a neutral position or extended position is the best position to immobilize the hand. We need to now prepare the POP slab on a Macintosh sheet to prevent messing up the table. Roll out the required length. Usually this required length is measured in spans. One span is usually equal to the length of one palm of the person. But remember, the patient's palm length will differ from the person who is applying the POP. The measurement should be taken from the patient's hand and the POP should be made out. We now pile up the layers of POP one by one over each other for the required length and the required number of layers. Usually we use about 14 to 16 layers. Now, after making the required length of POP, we cut off the POP sheet. Now this prepared POP sheet is in layers. This has to be taken as a whole and immersed gently in the basin of water. We must allow all the air bubbles to escape. This will ensure that the water has reached every single part of the POP slab that we are preparing. Now remove the POP from the water. Gently drain off the excess water and apply over the soft pad or dressings on the hand. If on the volar side, we should allow some movements of the thumb. So we need to make the palmar area of the POP slab a little narrower. If the POP is being applied on the dorsal side, we make sure that the wrist is kept in neutral position. After doing this, we secure the POP with a dry bandage cloth. We now allow it to set in the position as planned. Since we are planning in this volunteer to show the lumbrical position, we shall keep the metacarpophalangeal joints in flexion and interphalangeal joints in extension. After it is set completely, we must apply another layer of bandage to make it neat. This bandage is secured with a sticking plaster.
The first complaint by the person who has had a hand injury is pain. This must be mitigated. This can be done even in the home or factory by just simple elevation of the hand. Tablets or any drugs should not be given until the patient is seen by a medical practitioner. Once the person reaches the primary medical center, simple anesthesia in the form of a digital block or an axillary block can be given, but we need to remember it must be done only after a complete clinical examination and recording all the findings that are present. If the expertise is not available in the primary medical center to manage these hand injuries, the patient must immediately be referred to the next center after giving the basic first aid that we have already discussed about. Do not give a block before referring a patient to a nearby center. However, a block can be given if the period of transportation is going to be more than 6 hours. Sometimes we will come across total amputations of the fingers or the hand. What do we do in such situations and what is the first aid that can be done? The management of the proximal stump in such amputations is as already described for major hand injuries. The first aid can be done in the form of wash and a dressing. In amputations like this, which had occurred at a factory, if these amputated parts are available, they can be put back and good function can be achieved, as shown in this particular patient. So it is important to know that while giving first aid for a patient who has had amputations of the fingers or hand, we should also take care of the amputated part or parts. Only this will give the chance to put the amputated part back and give back function in the hand. So we should know the basics about how to preserve these amputated parts. The process is quite simple and makes use of readily available resources. First, we need to wash the amputated part in cool running water. Then, we dry the amputated part with a clean cloth. Then, we wrap the part in saline moistened gauze. This part is then placed in a clean plastic bag. This plastic bag is sealed, and this sealed plastic bag must be placed in ice and transported along with the patient to the referral center. Why do we need to preserve the amputated parts like this? The time that the part remains at room temperature after it has been amputated or the blood supply has been cut off till the time it is chilled or reconnected to blood supply is known as the warm ischemia time. Whereas the time between chilling of the part after its blood supply has been cut off and the time it is warmed by having its blood supply restored is known as the cold ischemia time, and this is usually maintained at 4 degrees Celsius. In warm ischemia time, bone, tendon and skin can survive for a maximum of 8 to 10 hours, muscle can survive for a maximum of 4 hours only, and digits or fingers can survive for up to 12 hours. But under cold ischemia time, bone, tendon and skin can survive up to 24 hours, muscle can survive up to 12 hours and digits can survive up to 24 hours. 1 hour of warm ischemia time is equivalent to 4 to 6 hours of cold ischemia time. So, preserving the amputated part correctly will ensure better survival of the tissues and better chances of success and return of function. So far, we have seen about the different techniques of first aid in hand injuries. The most important point to remember is that first aid in hand injuries is the first step to good healing and function.
I hope you enjoyed the video. I enjoyed making it. Please do click on the links to see more hand surgery videos and public awareness videos. And do not forget to subscribe to stay connected with the latest in learning, hand surgery, plastic surgery, trauma surgery and ethics. Vanakkam.